Hi, my name is Jessica Voss, and this is my journal number 2. Today we are assessing a 48-year-old female. We'll be assessing the eyes, the mouth, the ears, and also the sinuses, the parasinuses. Okay, so first we're just going to inspect the eyebrows. We're looking for symmetry here, and they are pretty even. They are well groomed, evenly distributed. The texture is pretty fine. There's no palpebral slant noted. I hope I'm saying that correctly. And then around the orbital area, there is no edema or sagging tissue. There's symmetrical on both sides. And then if you want to close your eyelids for me, we're just going to look. There are no tremors noted. They both look symmetrical. There's no flakiness, redness, edema, ptosis, no entropion or extropion noted. And then her eyelashes are evenly distributed. They're pretty long also on both sides, evenly distributed. And if you want to open your eyes for me, I'm going to look at the conjunctiva. Just look right over my shoulder. I'm looking at the conjunctiva. They're light pink. There's no discharge noted, no redness on top or bottom on either side. The sclera are white. There's no abnormalities really noted there. The cornea does cover the pupil and the iris. There are no arcus senilis noted. I actually just had a patient with that 2 days ago, and he was really proud that there was a blue ring around his irises, and I didn't know what that was till I was reading about it. So now I know that's from high cholesterol. I didn't know what caused that, but he thought it was a really cool thing. The anterior chamber is curved. There's no bulging or anything like that noted. Sorry. The puncta are kind of hard to see in this light, but they are both there. No redness are noted. They're symmetrical. The iris is also symmetrical and blue in color. Again, there's no arcus senilis noted. The pupils are black and symmetrical on both sides. They're both round. For the eye examination test, we are going to use the Snellen chart. Patient does not have any contacts in. You don't have any contacts in, right? Yeah, she has glasses on her head that she does use for reading. So I guess I'll just show you my teacher. And then we have the Snellen chart over there. It's posted. So we're going to have the patient stand approximately 20 feet away. If you wouldn't mind, be so kind. And then we're going to have the patient cover a little back a little bit. Cover one eye at a time. Okay. Sorry, this is kind of hard filming this, but I have the patient filming one eye at a time, and I ask the patient the lowest line that she can read.
F-E-L-O-P-Z-D.
Can you read one lower?
Nope.
Okay, and then if you could cover the other eye, and then read it from right to left.
D-Z-P-O-L-E-F.
Okay, can you read any lower?
Nope.
Okay, thanks. The patient's about 20 over 25, both sides. And she does use reading glasses, so she does have a little bit of hyperopia noted. So we are going to look at the peripheral fields here. Okay, if you could just look right over my shoulder, and I want you to tell me when you can see the pen.
No.
Okay, and then on the other side?
No.
Okay, so they're about equal on both sides. Now we're going to look at the pupils and how they accommodate to light. So just look right over my head. Okay, so shine a light in your eyes here. The other side. Pupils do go from about 4 millimeters to 3 millimeters. They're actually pretty sluggish, but I think it's because the room might be kind of bright. Oh yeah, no, kind of bright. So if you want to look straight ahead for me, I'm going to have you look at that sign, and then I want you to look at my pen. Okay, look at the pen. And then they're supposed to accommodate. It's kind of hard to see in this light because it is a little dark. Yes. And then now next we're going to look for the convergence of the eyes. So look right here. I'm just gonna... Okay, eyes do converse. Actually, the left eye's kind of... Oh no, they're good. Eyes, there's no like abnormal anything with the convergence. Looks pretty good. And then the extropia is not noted, or the esotropia is not noted. And I hope I'm saying those right. It's kind of hard because I've never heard those words before. Okay, so in a normal eye examination, we do an ophthalmoscopic examination, but we don't have an ophthalmoscope. So I'm just going to kind of verbalize what I would do. So we would dim the lights, and we're going to look at the retina. What we do is kind of approach the patient at a 15-degree angle with the light, and we're supposed to be looking for like a red reflex. We are looking for any abnormalities in the veins and arteries, make sure that there's no nicking noted. We are going to look at the optic disc. It should be yellow or creamy in color, and then with darker skin patients, it should be a little bit darker. The optic disc should also be like well defined and round, and we're supposed to look at the macula densa as well, and the best way to do that is to have the patient look directly in the light so that we could kind of see back there. I heard that's kind of a hard thing to see. And then with the scope, we are just going to set it to a negative setting for nearsighted patients, and then a positive setting for farsighted patients, and document any like abnormal findings using like a clock landscape mark. Okay, so now we're just going to be looking at the ears. So we're going to make sure that the ears are at a 10-degree angle. I'm looking at them. Okay, the other one. Okay, there's a birthmark on the left ear. Okay, the helix, antihelix are symmetrical. The lobules are a little bit enlarged, I would say, on both sides. Yeah, just a little bit enlarged. The external auditory meatus is normal. There's no discharge or anything noted on both sides. The tragus is normal as well. The color in both ears is flesh color. There's no redness or abnormalities there. No disformities, lesions, or nodules. The ears look fine. And with palpation, the auricles and the tragus feel good. And then the mastoid process back here, if you can see. We feel good, and the mastoid process feels good. They feel symmetrical. There's no tenderness, anything like that noted there, any nodules or anything. And then the auditory canal, we're looking for redness, swelling, narrowing, discharge, or odor. And again, I really didn't see tiny bit of cerumen in the auricles, but that's about it. Yeah, looks pretty good. And again, we don't have an otoscope, but if we were to have one, we would want to pick the biggest probe size that's possible to fit in the patient's ear. The patient does actually have pretty small ear holes. That's something that runs in the family. Again, mouth cerumen was noted, just light yellow. And then what we would be looking for is the tympanic membrane. We want to make sure that it's like a pearly gray color. It should be round. You should be able to see the light reflex. The umbo, the handle of the malleus, the pars tensa and flaccida, and the annulus are supposed to be noted as well, with a round contour, and no perforation should be noted. Okay, so now we're just going to do a quick hearing test to test the patient's hearing. I'm going to have you look at it straight ahead. We're just going to make sure it's equal, and I'm going to whisper something and have the patient repeat it back to me.
4, 3, 1.
Okay, now I'm going to come about the approximate same distance. Can you turn your head?
2, 7, 3.
Okay, so hearing's about equal on both sides. And then we are going to do the watch click test. So stare straight ahead for me, and then just tell me when you can hear. Clicking.
Okay.
Okay, again. Really?
Okay. Yeah. Tinnitus.
I can hear it really well. Okay, so patient does have decreased hearing. Couldn't hear the watch till it was essentially on her ear. And it's pretty audible from all the way out here. On both sides. But at least it's symmetrical for her. But I'm going to make a note of that. Okay, so the Weber test. Again, I don't have a tuning fork, but I'm just going to verbalize what I would do. So I would make sure that the tuning fork is vibrating, and I would put it right here on the patient's head, and I would ask the patient if she could hear it equally on both sides. If one ear is occluded, she should hear it louder on that side. And then for the Renee test, I'm going to, again, make sure that the tuning fork is vibrating. I'm going to hold it right here on the mastoid. Well, maybe I'll do it on this side. Right here on the mastoid process until she couldn't hear it anymore. And then hold it right in front of the ear until she couldn't hear it anymore. And that should be just even on both sides. Okay, so now we're just going to inspect the nose. The nose, just right off the bat, is symmetrical. There's no deviations noted. There's no discharge or odor, no flaring of the nostrils. The nasal bridge is fine. There's no inflammation or anything, no abnormalities there. The palpation of the nose, like the ridge is firm, just kind of how it should be. The soft tissues of the mouth, there's no tenderness or masses noted. And then I'm going to occlude one of the patient's ears just to make sure that she can breathe from both sides. Okay, take a deep breath in. Okay, and then the other one. Okay, very good. So both nostrils are patent. I'm just going to test the patient's smell. I'm going to have you close your eyes. I have 3 very distinct different smells. I'm going to have the patient see if she can identify.
Lemon.
Very good. Some chapstick. Okay. And then this one.
Hot sauce.
Ooh, yeah, that's hot sauce. That makes my mouth water. My mouth just salivate. And then we'll start off, we'll end with a nice smell.
Chocolate.
Yeah, very good. Okay, so patient is able to smell. And then we are going to look in the nasal cavity, and we don't really have proper equipment, but you can actually see pretty far just with like a light. So the mucosa is just pink. There's no lesions noted. No abnormal discharge or anything like that. No masses, lesions, no swelling, and the septum looks good. It looks symmetrical. Then we're going to look at the sinuses, the frontal and the maxillary, and we're going to percuss them. Just the frontal here and the maxillary. Oh, this is the maxillary, but I said it out of order. There's no tenderness noted. Feels all right. And then next is on our list is we're going to look at the lips for symmetry. The lips are approximately symmetrical. There's no edema or surface abnormalities noted. No cracking, no anything like that. No inflammation of that area. Okay, so now we're going to look at the gums. So if you look straight ahead, I'm just going to kind of take a look inside your mouth. You have to open your mouth. You have to open it. Yeah. The mucosa is pink. There's no lesions. Kind of wrinkly on both sides. Wrinkly mucosa on the sides. Okay, so we're going to look at the Stenson ducts and the Wharton's ducts. So I'm going to have you put your tongue at the top of your... Can you see? Can you see? Yeah. Okay. Look down for me. Okay. The ducts look good. Also, under the tongue looks good. There's no abnormalities, no like dilation of the veins or any abnormal colors or anything. You can just relax. And then we're going to look at the gums here. I'll pull down your teeth. Also, I would probably have gloves for this in a real person, but this is my mom. Sorry. Gums look good. There's no inflammation noted, no bleeding. What else am I looking for? No lesions or masses or anything like that in the gums. And then I counted her teeth. There's 29 of them, and she does have a few fillings that are about like dark gray in color. And then for the tongue, we're going to look at the dorsum. Okay, so I'm gauze here, so you stick out your tongue. I need to get it. Okay, so we're looking at the lateral sides of the tongue as well as the top. I already kind of looked at the bottom. Okay, looks good. It's not a very sanitary inspection. The dorsum look good. There's no swelling. It's just pink and moist. No abnormal coating or ulceration or varicosities were noted. And I have you just stick your tongue out. Can you move it from side to side? And up and down. Up and down. Not, yeah. Okay, good. And then I did look at the frenulums earlier, but I'll look at them again. We just want to make sure that they're, put your tongue at the top of your mouth. Yeah, and then I'm going to lift up this part. You can just relax. I get it, like, your frenulums. Relax. Yeah. Okay, so the frenulums look good. They're intact. I'm going to palpate the hard palate and the soft palate. And then for this, I'm just kind of using like a Q-tip here. Okay, just relax. Keep your tongue bottom of your mouth. I'm just going to poke. Okay, so the soft palate is soft and it's intact. Hard palate looks good and firm. No abnormal coloring or anything like that is noted. I'm going to look at the uvula and ask the patient to stick out her tongue. I'm also going to look at the tonsils and the tonsillar pillars to make sure that those are symmetrical. Good. Can you swallow for me? Yeah, it's good. Okay, stick out your tongue. Can you literally say ah? Okay, good. They move symmetrically. Very good. The uvula moves as appropriate. And in the posterior wall, let me just make sure. I didn't see anything back there, though. Yeah, looks good. There's no redness or white patchy areas, and no edema is noted. It's symmetrical on both sides. And then I'm just going to ask the patient to clench her teeth and then smile. Perfect. Okay, so that concludes my assessment. I hope you enjoyed it.